I'm Dr. Paul Stanislaw, and I'm a facial plastic surgeon in Avon, Connecticut. The topic of the video is chin augmentation in combination with deep plane facelift and neck lift. This is for a subpopulation of people who have a weak chin and what we call a low-lying hyoid. How do we evaluate patients with weak chins? Well, first what we need to do is sort of standardize their position. Oftentimes, those patients will walk with their chin slightly elevated to give the appearance that their chin is better. So if we lift up, it changes the shape of our neck and our angles. If we bring it down, it makes things look worse. So the first step is to standardize their position. And what that means is to take an imaginary line that goes from the top of the external auditory canal to the bone of the inferior orbital rim right here, and you draw that imaginary line right there, and you bring that line parallel to the floor. Once you have them positioned, looking from the side view, you then drop an imaginary line at a right angle from underneath of their nose towards their chin, or from the nasion here, the hollow here, down to their chin. The chin should come up to that line. Now, when people have weak chins, their chin is behind that line. When their chin is behind that line, it impacts the appearance of their neck. So there's nothing really to bring that neck out, that soft tissue, so everything sort of sags, and it makes this look worse. So in a lot of patients, if you imagine this is their jawline and this is their neckline, okay, they have a very acute angle here between their jaw and their neck. For these patients, when they have a weak chin, they often have that low-lying hyoid, which takes that bone that's way up here and shifts that out. So it gives them an appearance of having a very large open angle under their chin and a bad neck. When patients have this, they will benefit drastically from having a chin augmentation. So in these procedures, when we're doing a facelift neck lift, the facelift neck lift lifts the jowls, it takes the platysmal bands, these two bands that are hanging down here, and it takes this fat and it redistributes that up this way. It's a rotation event this way and brings this up. But no matter what you do, you can't make their low-lying hyoid or their foundation shift backwards. So what I tell people is you're only as good as the foundation that you have. So when you're in that standardized position, you take your finger and you hit where you hit something hard, that's your hyoid bone. You can't move that back. I can't surgically shift that back. So what do? In these patients, when they have a low-lying hyoid, I'm actually going to do this chin augmentation and bring the anterior aspect of their chin out like this, make their jawline longer, and by doing this, it gives the illusion that their neck angle is better. So if it's pre-augmentation, it's like this. You augment, you bring this out, it makes their neck look better, and it sort of hides that low-lying hyoid. So not only does the weak chin affect the anterior projection of the chin, but it also often affects the pre-jowl area. So right here is the jowl, and right in front of that area is the pre-jowl area. And oftentimes, because of the congenital shape of the jaw, not only is it weak here, but it's also weak in this area. And when it's weak in this area and depressed through here, it makes the jowl look bigger. So here is a close-up picture of someone with a weak chin, and you can see that there is a pre-jowl depression where that jawbone isn't giving a nice defined jawline. And because of this hollow in front of the jowl, it makes the jowl look bigger. So in this situation, we use what's called an extended anatomic chin implant, and this is an example of one. Not only does it increase the anterior projection, but it also increases the projection on the side in the pre-jowl area, giving a more defined jawline and blending the anterior chin into the jowl area. So it's very important that we use this type of implant. There are many different implant shapes and sizes, and sometimes people will just use what's called a button implant, an implant that just sits in front of the chin right here. And if we do this, what happens is it makes this go anterior, doesn't improve or augment the pre-jowl depression area, and that makes the jowl look worse. So this situation here, this is an again extended anatomic chin implant. This one is made of EPTFE, that's the fancy term for Gore-Tex. Just like Gore-Tex, this implant has little holes in it, little microscopic pores, and those microscopic pores allow the tissue to grow into the implant, thereby fixing it in place so it doesn't rock, doesn't move. Also, the little pores prevent the formation of a capsule. When people use implants that are like a siliconized plastic or a ceramic, the tissue can't grow into it, and so it forms a capsule around the implant, and the implant can rock and move in shape. So not only is it important to choose the right shape, but it's important to choose the right material. So what's also nice about this material is that because it's made of solid EPTFE, I can take a scalpel and I can shave it down and I can sculpt it to the appropriate size and shape for an individual patient. As you can see in these before and after photographs, the addition of a chin augmentation with a deep plane facelift and neck lift has a profound impact on the appearance of the patient's neckline, jawline, and chin projection. Not only does it improve the neck and the jawline, it also improves the balance and harmony between the lower third of the face and the upper and middle thirds of the face. I hope you found this video on the combination of chin augmentation and deep plane facelift neck lift informative. If there are any questions or if you wish to book a consultation, please call the office. Thank you for watching.